The federal government is moving to protect healthcare workers. It's put forward legislation in response to a series of protests at hospitals that intimidated and endangered healthcare workers and patients.
You know, when we look to the protests that were happening outside of hospitals, these were not peaceful protests. These were people getting in the face of patients, vulnerable patients trying to access care, yelling and spitting on them, following healthcare professionals to their cars, vandalizing their vehicles, people feeling threatened that people may be following them home. I've heard from many physicians that have received multiple death threats. One of my colleagues in the Yukon received 6 death threats in one day.
The bill also brings in 10 days of paid sick leave in the federally regulated private sector. Seamus O'Regan is the Minister of Labour. He's in St. John's. Minister O'Regan, thank you so much for speaking with us. The NDP has been calling for legislation on sick days for months and months. What took so long for this to happen?
Well, it's in the platform, and it's one of the first items that we're coming out with as a legislative priority. So, I would say here we are, we're moving fairly quickly, I'd like to think. And, I would like to get this done as quickly as possible, to be completely frank. This is the right thing to do. This comes, from the pandemic. The reason why we are calling for 10 days is because that's roughly what people will need if they're, quarantined for 2 weeks. We all know, that's kind of become part of the lingo is, we just assume 2 weeks, 2 weeks, 2 weeks over these past 2 years. Well, for a lot of people, that means time off work, and they've had to choose during the pandemic. That's something that we've learned. People who are worried about groceries and rent or trying to do the right thing, like, is this sniffle serious? Well, if we want them to stay home, out of an abundance of caution, another phrase that we've been hearing a lot of. We want to do the right thing. And look, the fact of the matter is most workers out there do not get paid sick leave. And they should. So let's start here. Let's start with those industries, companies, jurisdictions within the federal purview, and let's start looking after the workers there.
But, could this legislation not have been useful for the height of the pandemic? Should you have not acted sooner on this, given that, by and large, most lockdowns in Canada are over, and yes, people are isolating if they have symptoms and people are not going to work. But would this not have been more helpful at the height of the pandemic?
Well, look, I'm not going to get hindsight. I mean, we're here now and we're doing it. And like I said, it's one of the first priorities of this new government going into this parliamentary session. We know it's a priority, and we've already seen, since the announcement just earlier today, applause from Unifor, from the Canadian Labour Congress, from the BC Federation of Labour, and going across the country. This is something that they have been looking for some time. Now's the time to do it. We are still fighting our way through COVID. That's the bottom line. And there's always a concern of a future pandemic. So let's prepare now. These are lessons learned, I agree, from the pandemic. Let's enact, let's prescribe, let's do the right thing.
Today's announcement also includes new measures to keep healthcare workers and patients safe. What does it say to you about the state of this country that these kinds of measures are necessary to keep frontline workers and patients safe?
You have an emotional reaction when you see it. I think, like millions of other Canadians, I was disgusted by what I saw in how nurses and doctors in this country were treated, and it shouldn't be allowed to happen. I was, son of a nurse, upset, but you have to put that to one side. Be clear-minded about what we do to make sure that is prevented from ever happening again, particularly during a pandemic, but ever. And we think, I think that the Minister of Justice and his officials have gotten this right. We, of course, had an eye to this to make sure that, freedom of assembly and strike action were incorporated in there. They have been. But this will give us the tools that we need to make sure that, that sort of thing doesn't happen.
Do you think more severe penalties will be enough to deter the people behind these kinds of threats?
Well, we're upping it from 5 years to 10 years. I'm hoping. Yes, certainly we are giving law enforcement more tools that they need in order to make sure that they can police situations like that, that there is no doubt in their mind. And frankly, there is also, you can criticize, some people will criticize as a political statement. I don't see it as political when you are telling healthcare workers in this country that you support them in a real way and you do not want this to happen to them again. That is real, and that is very real for them, for those workers.
Does this legislation do anything to protect healthcare workers from online threats and online harassment?
I'll let Minister Lametti get into that. I mean, to be honest, Katie, my role in this was just to make sure that we looked after workers, the freedom, of assembly and their safety and security. Online harassment, well, it is. I would just say this: it is certainly a growing arena of intimidation, and one that we got to keep an eye on.
Well, certainly we had a doctor on our program in the past couple of weeks who talked about the online threats she's been getting. She ran these things called Jabapaloozas to help get vaccines into arms in communities in Ontario, and the online threats that some of these doctors are facing and the harassment has deeply disturbed them, deeply concerned them. Do you see disinformation and this kind of thing spreading on social media? Is that the root cause of this harassment we're seeing right now? The spread of disinformation and misinformation on social media?
I think disinformation and misinformation certainly doesn't help. That's for sure. I mean, there will be, and there has been, and there will continue to be ongoing analyses of, what the heck is going on here. Now, I mean, look, you can go through human history, and particularly in pointed times of human history, like pandemics that have occurred before, and there's always been misinformation and there has always been intimidation. Can we cut down on that? Because, we live in a society now where misinformation can spread like wildfire to millions of people with a point and a click. So, how does government keep up with that? How do we look after people? That is an ongoing challenge that, is beyond even just this pandemic or looking after healthcare workers. It is something that, as various ministers within our government have been trying to confront in their various jurisdictions. It is a problem. Yeah.
Even with the new measures you've announced, are you concerned or are you sort of monitoring to see whether there's going to be an uptick in harassment of healthcare workers now that we're moving into the vaccination of children?
I mean, we will absolutely. I think it's fair to say, of course, we'll be monitoring it and we'll be working with provincial authorities on that score as well. But I mean, one would certainly hope that the worst of this, the worst of intimidation, is behind us. Anyway, let's wait and see, and let's hope. I have great faith in the government and our intentions, certainly behind this bill, and making sure that we are there for healthcare workers.
All right, Minister O'Regan, thank you for your time today.
Thank you, Katie. Appreciate it.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.